The Significance of Nuclear Medicine by Bailey Schutza for the purpose of Chemistry 110N Lab, Section 4 for fall of 2022. What is nuclear medicine? Nuclear medicine is a specific field of medicine that is able to recognize and treat various diseases and cancers. It is done through the use of radioactive tracers and high-tech cameras that detect the tracers. So a radioactive tracer is a carrier molecule that is tightly bonded to a radioactive atom, and the accumulation of where that radioactivity lies is where the medical issue prevails. A tracer is most commonly given through intravenous injection, which is your typical IV. However, it can be given through oral injection or just be directly administered into the organ itself. The technology used are PET and SPECT scans. So a SPECT scan is a single photon emission computed tomography, and a PET scan is a positron emission tomography. These scans are very similar, however, they differ in what they can detect and how they do it. So in terms of which radioactive tracer is given, that can depend on what scan you are given. And then the radiation in tracers is the same amount as in chest x-rays or CT exams. And this is how your typical PET scan works. So you will have your radioactive tracer over here, and it will go through successions of decay. It will emit a positron, which will react with an electron, and it will give off 2 photons. And these photons are what is actually being detected by the PET scan itself. So for historical development, nuclear medicine started in 1934 after the development of artificial radioactivity. It was created by Frederick Joliot-Curie and Irene Joliot-Curie. However, the most credit is given to Marie Curie, which is Irene's mother, for her discovery of radioactive elements, her contributions to cancer treatment, and her mobile X-ray machine, which was used in World War I to help combat bullets and soldiers to help treat them faster and more efficiently. And then in 1946, a patient's thyroid cancer was successfully treated with radioactive iodine. This is a significant time period for nuclear medicine because that was the first case successfully treated with nuclear medicine. And then over here you can see just the overall developments of scans and their accuracy and precision as well. In the 1950s to 1960s, that is when we see the most rapid growth of nuclear medicine. And then in 1971, it was officially recognized as a treatment option. In the 1980s, your first successful PET and SPECT imaging. So this is also significant because those are the most 2 common scans that we see today. And then in 1991, the FDA approved TC99, which I will get more into this later. However, TC99 is used in 80% of all cases, which is roughly 40,000 a day. And then in 2008, you have your first hybrid PET and MRI. This also was significant because it is more time efficient and it is more cost efficient, as well as being more accurate. For some present developments, we see the usage of SPECT and PET scans. Again, those are just our most common use today, and the developments keep improving. Radioactive cancer treatment. We all know someone that's gone through cancer treatment, and a very significant development of today is how successful these treatments can be. And then we also recently have a PET probe that was FDA approved, and it diagnoses Alzheimer's. And Alzheimer's previously was not able to be accurately detected and diagnosed until after a patient had died. So it is significant because now doctors are able to accurately diagnose patients without them having to be deceased first. And then again, the use of TC99, which is used in the most cases today. So for future developments, The medical field hopes to recognize nuclear medicine in a routine part of clinical tools, as well as brain PET tracers, so you can visualize neurodegenerative disorders as well as psychiatric conditions. Another development is to be simultaneous whole body PET and MRI, so not just a specific area, but the whole body itself, which again would be cost efficient and time consuming. And then there are already studies concluding the advancements in cardiology and oncology today of nuclear medicine that are to come. And then over here, you can just see how your standard bone scan is compared to when the TC99 is available and injected. So obviously the scan is more, it tells you where the issue most commonly lies with the TC99. Chemistry involved. So radioactive elements, radioactive decay and half-life, Marie Curie, alpha and beta particles, as well as gamma rays. These are all common things that we have been learning in chemistry today. And in your example over here, you can see your radioactive tracer. So in this example, it is Alpharidin, which is a potential future cancer pharmaceutical. And then you can see over here how it will emit radon and it will emit helium. And this helium over here is actually an alpha particle. So that particle is what will actually accumulate near the cancer cells. And as this reaction occurs, those alpha particles will go on to kill the adjacent cancer cells. In our example below of TC99, you will have your TC99. It will go through its successions of decay and reactions, and it will emit a gamma ray, and this is what you will be able to detect on the scans. So your role of experts. Obviously, you have your nurses and doctors certified in radiology and radiation treatment. The FDA has to approve radioactive tracers. You have the EPA, which is the Environmental Protection Agency, the Nuclear Regulatory Commission, the Department of Health and Human Services, Department of Energy, Department of Defense, Department of Transportation, which is just how you transport these nuclear items and substances, your Occupational Safety and Health Administration, and the International Atomic Energy Agency. And then all of these agencies and departments together work to keep each other in check and in line to ensure the most amount of safety is given to patients. Some positive societal impacts of nuclear medicine are obviously just cancer treatment, which obviously if you have a very severe case you want to be treated no matter what. So nuclear medicine allows doctors to treat patients, which wasn't done before. Disease treatment, obviously, just like how I said before with the PET probe, the bone cancer, just various diseases, it is more effective. So these images are able to tell doctors more accurately, more precisely. Less invasive procedures. So doctors are not having to go in and perform surgery in order to tell what exactly is wrong, where it lies. And then improve patient care, obviously just with the advanced treatments. And then can detect early progression of diseases. So you can tell earlier before a cancer is developed into something more severe, where it is, how it is, and then even in the case of the Alzheimer's, where you couldn't detect it or diagnose it post or pre-mortem, we can now because of a probe. And then in this diagram, you can just see how a tracer is given through an IV. It will accumulate through the body, and then it will be detected on a scan. And then these are the positive aspects of TC99, which you can see below its complex structural formula. So it does not stay in the human body for long. It has a 6-hour half-life, so that means it will be flushed out of the body, like after no time at all. It is the most common tracer, as I previously mentioned. It is used to detect injuries, infections, tumors, heart disease, thyroid abnormalities, kidney issues, and some cancer procedures. It is common in bone, heart, lung, kidney, brain, white cell, thyroid, and lymph node scans. And then another positive aspect is the fact that it is widely used in research studies today. So it is providing us with more and more information that will help doctors and researchers further the field of nuclear medicine. Some negative societal impacts are just radiation risk and exposure in general. Obviously, there are specific procedures put in place for doctors and radiation doctors as well, because they are just the ones mostly exposed to it, as they're around it most of the day. And then as well as pregnant women and children, obviously they have more of a risk due to the changes and prematurity of their body. So there are safety procedures in place to ensure the most amount of safety for them. It is costly. For example, a CT exam without insurance is roughly $4,000, and no one just has $4,000 to throw away. So it is costly. And then it isn't 100% foolproof, but honestly, what is in the medical field, there's always new advancements improving things every day. So nuclear medicine is not 100% guaranteed to treat your cancer. However, it is the best option too. So in conclusion, nuclear medicine and its significant advancements have helped the medical field more accurately diagnose, monitor, and treat various cancers and diseases. And then there's many people keeping nuclear medicine in track to ensure the most amount of safety to all patients. So in all, the risk is worth the reward. Here are my references. Thank you.